1980, thousands of people flee their home country because of the communist regime in place in Vietnam. A team of volunteer doctors embark on the Boat for Vietnam project. Along with journalists and photographers, they want to provide care and bear witness to the despicable living conditions of these forgotten people. Doctors of the World is born. Our founding principles: going where no one else goes, wherever poverty or social injustice strike, bearing witness to the unacceptable and working as volunteers. In the 80s and 90s, Doctors of the World develops programs around the world. A domestic program is also created in France to fight social exclusion. Economic growth, climate change, growing urban centres, increasing migratory flows, Doctors of the World faces the challenges of a new century. Drawing on our history and legitimacy, we want to reaffirm what brings us together and redefine our project for the future. As members of Doctors of the World, we want a world where barriers to health have been overcome and where the right to health is recognized. We believe social justice can guarantee fundamental rights for all. We help empower all vulnerable populations to take action within their social environment, to become actors in their own health and to exercise their rights. As a movement of engaged and militant professional volunteers and paid staff, we provide medical care, bear witness and, thanks to our diversity, support populations seeking social change. Our organization is independent of all political, religious or financial authorities or interests. Independent in the choice of our programs and in our operating methods. We foster dialogue with the people and the communities we work with. We seek balance between national and overseas projects, between emergency and long-term actions, between medical and lay knowledge, and between public funding and private donations. Wherever we operate, we provide care for and work with the most vulnerable populations and support improvement of health systems. We want populations to obtain real access to healthcare. Beyond indignation and revolt, we seek to denounce injustice and call upon deciding authorities to facilitate access to healthcare and promote respect of human rights. It's our aim to influence political decision-makers to obtain better health protection for individuals and communities, to reduce inequalities in access to health. We are convinced that to achieve lasting change, populations must be empowered to become actors in their own health. Beneficiaries are involved at all stages of our programs. We support them in developing public health policies. We foster partnerships with local representatives, NGOs and civil society movements or institutions. We have to ensure the quality and relevance of our practices by constantly evaluating them. It's our responsibility to ensure the sustainability of our programs when our interventions come to an end. We strongly believe in people's ability to refuse, denounce, and take action against the unacceptable. That's why we adhere to an alternative humanitarian model based on health and social democracy. We measure the strength and relevance of our actions by their medico-social impacts rather than by the amount of allocated funds. Our financial independence, which ensures our political independence, is secured by diversifying our sources of funding and, above all, by the general public's donations. In this way, our choices are based on humanitarian ethics and our priorities. Our freedom of speech and action is not negotiable. To take effective action in a complex, chaotic and uncertain world, a network organization is essential. Doctors of the World associations share the same vision, identity and values. Each has projects in its own country and runs or supports programs throughout the world while forming local alliances to achieve development goals. Citizen commitment and voluntary work are the linchpin of our associative model. This commitment guarantees the quality of actions and extends the reach of our advocacy. Our governance bodies open up and adapt to all stakeholders, members of the international network, partners, employees, beneficiaries and donors. Everyone takes part in the decision-making process. As such, everyone can contribute to the present and the future of society wherever she or he lives, working towards real equality and extending rights.